Dr. Mase, thank you so much for taking time out of your busy schedule to be with us once again to talk about the topic on everybody's mind, testing. What does that mean for our community? And what does that mean as we move forward in reopening our economy? First of all, give us a really broad overview of why is testing so important? Where are we going? How many tests do you think should be our goal? And what does that mean for us?
Well, thank you so much for having me, Chairwoman Gorin, and I'm really happy here to be able to talk about testing. Testing is very important because it allows us to know who has COVID and who doesn't, and what the proportion of people in the community have COVID that may even be asymptomatic. So for example, what we've been doing up till now is testing people after they get symptoms. And then we've been extending that testing to healthcare workers that are symptomatic and asymptomatic, and first responders that are asymptomatic and symptomatic. But now that we have 2 new testing sites open as of today to test everybody and anybody in the community that wants to be tested, it'll be really nice for us to know how many people in our community actually have COVID and don't know because they have no symptoms. It also gives everybody the opportunity to get a test and to feel reassured that after being tested, they'll know what their status is. And I think that says a whole lot. Now, about the number of tests needed, I have mentioned that we'd really like to be doing somewhere around 700 to 800 tests per day in Sonoma County. And this comes from data that's been put out by Harvard, CDC, and the California Department of Public Health, suggesting that we need about 150 tests per 100,000 population. I'm really happy to say that we're reaching this goal. As you already know, our public health lab is now ramping up and performing, in addition to the 120 tests run at the public health lab, we're also sending an additional 200 to 250 tests to UCSF lab for testing. As of today, as I have already mentioned, we have opened 2 sites by OptumServe, which is a contractor that's hired by the state. One is in Santa Rosa, one is in Petaluma. And these sites are allowing us to test an additional 130 persons in the community per day. That, combined with all the testing done by our hospitals and clinics, allows us to be pretty close to that 700 to 800 tests a day that we're projecting to do.
Which is fabulous, and we thank the state and of course our public health lab for doing all of the processing, as well as our healthcare providers. So we've had a couple of models that we've talked about publicly, and thank you for explaining what the modeling is. The first model projected a pretty steep curve, and we thank our community for sheltering in place and wearing facial masks, because it's demonstrated and borne out by our second model that we indeed have flattened the curve. So even with the second model, they are projecting a surge, but maybe a lower surge. So when will we see that surge, if we see the surge?
Yeah, well, you know, we're so lucky that our shelter in place went into effect pretty early in terms of the number of cases that we had, and I'm really thankful for everybody who complied with it, since we've managed to flatten the curve. But you're right, now that we're going to be opening businesses for curbside pickup and other sectors moving forward, aligning with the state, we will see more cases. Will we see a surge, or will we just see more cases that are manageable? Well, I'm really hoping that with the intense contact tracing that we're doing, that we can get all the cases diagnosed quickly before they're spreading in the community for too long, and isolate them, and then also find the contacts, test them, and quarantine them, that we will have more cases, but that we will be able to manage the number. Now, will we have a true big surge? I think we're going to find out. And as the governor has already stated, the 6th criterion for opening up is to know when you potentially need to put restrictions back into place. And we'll be looking at all this really closely as we move forward, but I'm really happy to say we're very close to start opening retail businesses for curbside.
And I'm excited about that as well. I think our community has some pent up demand for supporting some of our local businesses. In general, how are we responding to the orders and now the lessening of the restrictions? What are your reports? What are we seeing in the community?
Yeah, I think things are going really well. I'm very happy to say that our Parks Director has been observing that people are pretty much complying with all of the recommendations and guidance that we've put out through the order in terms of carrying facial coverings when they enter the park, maintaining the social or physical distancing from other persons, making sure that if they're not overcrowding. And so I've been really happy with that. As far as the facial covering order, people are, again, I think complying with it. And that's why we're going to be able to move forward towards opening up.
The governor has alluded to in his roadmap to recovery and the phases that he'll be looking for. And other counties have really documented and graphically what the phases might look like so that what we can expect to see in the coming days and weeks. So what phase are we in, and what phase do you expect will be enacted as you work with the board and with our economic development director in reopening our economy?
Right, so right now we are still in the phase one, the safety and preparedness, and that's why we're doing expanded testing and the conducting of intensive contact tracing, making sure our hospitals have surge capacity, making sure that our healthcare workers have personal protective equipment, those kinds of things. But we are going to be moving into phase two, which is the limited reopening of lower risk settings. That, again, aligning with the governor's roadmap. We also have our own roadmap for what triggers reopening, and it's aligned with our other counties around us as well as the governor's order.
So I know that the board next week will have an animated discussion among ourselves, but also with our economic development director and some of our business leaders. And I would assume you are part of the mix and having that conversation about reopening safely. So I just want to alert the community that we're going to be hearing about that next week at our virtual board meeting on Tuesday, I believe in the afternoon. So what can residents do to help us get on the road to recovery a little faster?
Well, I think they're doing a lot of the things that we've wanted to see happen. I would just advise people that as we move towards the reopening, that they just abide by the existing guidance and orders, basically the facial coverings, which I think everybody is following, all of our general hygiene measures, the cleaning of surfaces, the, physical or social distancing, and the parks. Please do visit our parks, but do follow all of the guidance that we've given. As I said, I think we're getting there. We're working very closely with the community towards reopening. And if all goes well, we'll be in a phased, gradual manner, beginning to allow our businesses to come back and start working and opening. And I think that's going to be really a relief for a lot of the community.
I know our businesses are anxious to reopen to satisfy the demand of the community and to get our employees back to work as quickly as possible. But what can they do to help the community recover? What protocols are they going to be required to implement?
Well, we have put together some mitigation strategies for businesses with a very clear plan that businesses need to follow to ensure that as they move towards opening, that they are maintaining protocols and procedures to make sure that they minimize risky behaviors. So minimize person-to-person contact by trying to do telework for as many of the activities as possible. If people need to come into work, then they should be socially or physically distancing, wearing the facial coverings. If you're sick, definitely making sure that employees don't come into work. In fact, we have an app that we'll be introducing next week with IBM that allows employees and employers to ensure that people are screened prior to coming to their shifts at work. So this app will allow employees to just answer a series of 3 questions to see whether they've had contact with anybody who has COVID, to see if they have any symptoms. And if they are cleared after the few questions, then they can present that to the employer and go to work that day. Of course, if they have any symptoms, they'll be redirected to go follow up with their physician or provider to get tested or evaluated further and cleared. So this will be a really exciting thing that we're putting out that businesses can use as a tool to make sure that employees are safe coming to work. And then, of course, we're also wanting social distancing protocols to be clear and posted by businesses as the essential businesses are already doing, and that that all these things are enforced as well by businesses. So this is a good plan that we have in place.
It's fascinating to me that we in government are using technology to, of course, record this video this morning safely, but also we are using technology to help our businesses and employees be safe coming back to work. And we're so grateful that technology is available to us for both testing and certainly now to keep us safe as we reopen our economy. Dr. Mase, thank you for all that you are doing to help keep us safe. It's a pleasure and an honor to work with you. Thank you.
Thank you so much. I really appreciate Board of Supervisors and all that you do to keep our community safe. Thank you.
It's a teamwork, and we are all in this together. Stay strong, Sonoma County.